Oh, hi, Megan. Well, we're here with Megan and her mom, which came down from Oklahoma to have a gastric sleeve. And I was wondering why did you decided to come down to have this procedure with us?
I had followed quite a few of your patients. I knew them personally, and so I've seen the good when they come back, the good results they had, and the good experiences and stuff like that that they had. So that's what made me decide to go with y'all.
Okay, and how's in your experience in Mexico these days?
It's been okay. I mean, we just really, the whole reason we haven't gone out and explored or anything like that. We were here for this, so this is what we focused on and stuff like that. But everyone's been really nice, really hospitable, that kind of thing.
Okay. Yes, I was wanting to do the video because patients always ask me if it's safe or so I wanted patients to know from patients coming down from the States, their to share their experience.
Mm-hmm.
And I know your mom is a nurse on the States, so I asked her a while ago why, and I will ask her again, why do you, what made you decide to come down with us? I mean, you're trusting your daughter's life to us, so.
Well, like she said, she's knows several ones that have had the procedure done here. They said it was very safe. They've had good results, and of course, you know, she's still young, and she hasn't had a lot of health issues yet. But you know, with obesity, it's going to end up there. So she's trying to head it off before it gets to that point.
And she's at a really good age where the risk of surgery, it's like not that high because she's still young, and well, it was a really good time to have done the procedure. And some patients, the ones that you know come back for plastic surgery, is that something that you're looking forward on having too, or?
Well, I don't really know. It kind of depends. I'm hoping that since I am younger and stuff like that, and I got this done as early as I did, that I technically won't really need it as much. But that was one of the reasons when I was telling her about it that I knew that it had to be okay here, because I knew girls had, or even men that had come down here, had the sleeve done, and then they turned around and come back and had more, like the mommy makeover or something like that. And I told her if it was something horrific or wasn't safe or something like that, they wouldn't come back to the same doctor here twice. So.
Right. And was this what you were expecting? I mean, this has been painful in some sort of way?
That afterwards, I wasn't expecting all the nausea as much as I had, but as far as pain-wise and stuff, it was easier than what I was expecting. It was just once I got past the nausea, then I was fine. The pain was a lot easier than what I was expecting it to be.
Okay, you have less than 24 hours that we got you out of the OR. Were you expecting to feel like this 24 hours after?
No.
How about you, ma'am? Did you thought that?
Well, actually, she's done really well. You know, I've been with her when she's had like C-sections and things, and of course that's a little bit different than this, but
right, C-sections.
But she's done really well with the pain. Like she said, when she got past the nausea, she's been fine.
I think we are really in a good. I mean, to do laparoscopic procedures, this is what it happens to patients. They get recovered real fast, and the reasons are because we do small incisions, like 5 millimeters, and we introduce the camera and the surgical instruments through there, so that the body really doesn't have that much of incisions. And even when we cut the stomach and we cauterize the blood vessels, so it's bleedless procedure. You don't lose that much blood as patients would do on C-sections or that another type of procedures. And well, we have seen your X-ray, and there's no leakage coming outside of your stomach, so you're good to go. Our driver will pick you up tomorrow morning. He speaks good English, and he'll take you down back to the airport, so you girls can go back home to Utah. Oklahoma, right? I get confused with all the people coming in. I don't know if there's something else that you would like to add up, or that will help us bring more patients in. So, because I know it's expensive on the state, so
Yes, it is, and so it's not available
right.
to a lot of people as an
Even
option.
with insurance.
Even
you
with
still
insurance, it's not available to them.
Yeah.
I think making it affordable, it's one of the reasons that let people come back to get to try to enhance their looks, even because it makes us affordable to the people.
Yeah, so it's gonna correct a lot of health issues for a lot of people.
Yeah, that's really important for us to help patients be healthier.
Yeah,
'Cause-
when I was a young nurse, you saw just a few diabetics. I mean, very few. Now, out of patients, you probably 75% are diabetics.
Yeah, it's a really common, and to see all the complications of diabetes, like the heart disease that are associated to it, or the kidney disease, and it's a heart mortality rate.
Yes.
Yeah, and that's really associated with overweight and hypertension. So, good thing you're not going to have to go through all that.
Yes.
Alrighty, well, we're gonna let you girls rest because you just had surgery like less than 24 hours.
Yeah.
Okay. Thank you very much for sharing your experience.
Welcome. Thank you.
Thank you.
Okay, well, bye. Thank you.